Welcome to this brief video on Angelica, Sage and Soltan, or the 4-substance decoction. This presentation will show why a combination of herbs will usually be better than taking a single herb to treat a given condition. In his compendium of Materia Medica, Li Shizhen quotes a Song dynasty text which says, taking Danshen is equivalent in effect to taking the formula Soltan. If you watched my video on the history of Chinese herbal medicine, you will remember that Li Shizhen wrote the Bencao Gangmu, or Compendium of Materia Medica, in the Ming Dynasty. This exhaustive work was to become the reference herbal in China for the next 400 years. It corrected many previous mistakes, but at the same time he introduced much new material, sometimes quoting other authors. Inevitably, some of this new material also included erroneous information. Soltan, or the 4-substance decoction, is an important formula for treating menstrual problems. Li Shizhen's comments on Danshen were subsequently disputed by many doctors. Nevertheless, this does give us a useful excuse to examine this claim, to investigate the notion of a single herb versus formula, and to look at two individual herbs more closely. Danshen is Chinese sage, whereas Chinese Angelica, or Tang Wei, is an important component of Soltan, or the 4-substance decoction, hence the title of this video. Here are a number of reasons for choosing a combination of herbs rather than a single herb. First, using multiple herbs can exploit their synergy, resulting in a stronger healing effect. Multiple herbs will help us adapt the formula to a patient's specific signs and symptoms, as determined from 8 principles pattern differentiation. Perhaps additional actions are required based on the patient's complaint. We may want to deal with possible side effects of certain herbs. And finally, we would certainly want to counteract or reduce any toxicity related to any herb. TCM has many formulas that are used almost universally in China, and these formulas have a history of usage that is often many hundreds of years old. There are very few single herb formulas. Neither Tang Wei nor Danshen is prescribed as a single herb. In Western herbalism, there is no established canon of herbal formulations. Greater emphasis was placed on the effects of single herbs, which historically were called simples. If multiple herbs were prescribed, they were called galenic compounds, after the influential ancient Greek doctor Galen of Pergamon. In practice, Western herbalists often use their own preferred combinations. Some follow the theory of humours or use an eclectic mixture of methodologies. There are no equivalents to the classic Chinese texts on formulas, such as the Shanghan Lun. As I mentioned before, the 4-substance decoction, or Soltan, is a basic formula commonly used for treating menstrual problems, such as dysmenorrhea and amenorrhea, that is, painful or scanty menstruation. Soltan consists of 4 herbs: Tang Wei, Baishao, Shudihuang, Chuanqiong. Tang Wei is sweet, acrid and warm. Baishao is bitter, sour and mildly cold. Shudihuang is sweet and slightly warm. Chuanqiong is acrid and warm. When we look at the properties and actions of the individual herbs, and the formula as a whole, we can see a lot of similarity, especially so with Tang Wei. So it would really appear that Tang Wei alone could substitute for the effect of Soltan. However, we can see that the properties of the other herbs allow us to modulate the formula specifically for a given patient's symptoms. Tang Wei is very popular with modern Western herbalists, who more commonly refer to it as quai. In fact, for many practitioners it features amongst their top 10 prescribed herbs. In the media, quai is promoted for an embarrassingly wide range of benefits. It can certainly be beneficial for some of these issues in the right circumstances and in the appropriate formula, but using this herb alone would be a long shot and could even be detrimental in some cases. As I pointed out in a previous video, the TCM practitioner would follow the following approach. They would examine all the relevant signs and symptoms, make a diagnosis, determine the syndrome, and then prescribe a formula with added herbs to treat any additional symptoms. Rather than using Dong Quai to treat any of the conditions I just showed, it would certainly be better to first speak to an experienced herbalist. Now let's look at Danshen as a potential replacement for Soltan. Danshen, or Chinese sage, is a woody brown root. According to TCM, its properties are bitter and slightly cold. It is associated with the heart, pericardium and liver channels, and when we look at the 5 transformation correspondence, we see that the bitter property is associated with the heart. You'll remember that Soltan consists of 3 blood tonifying herbs and 1 blood invigorating herb. Danshen invigorates and tonifies the blood. Its ability to invigorate is stronger than its tonifying or nourishing function. This is the converse of Tang Wei, which is considered to be better at tonifying than invigorating. So it would be more reasonable to compare Danshen with Chuanqiong, which is the invigorating herb in Soltan. Danshen is bitter and cooling, while Chuanqiong is acrid and warm. Danshen invigorates and cools the blood, while Chuanqiong promotes the movement of qi in blood. Pain is often associated with stagnation in traditional Chinese medicine. Danshen acts against stagnation. Chuanqiong is good for headaches. As Danshen is associated with the heart, it is said to soothe irritability due to heat. Chuanqiong acts on the exterior to expel wind. Because of its blood-invigorating property, Danshen should be avoided during pregnancy. So is Danshen equivalent to Soltan? Danshen is a cooling herb, while most of the herbs in Soltan are warming. Danshen is more closely associated with the heart and pericardium channels, so it's more suited for patients who show irritation rather than just fatigue. It is also useful for patients with insomnia. Apart from the difference in overall properties, the herb alone would probably be insufficient to deal with a menstrual problem, but it is certainly a useful herb for modulating the effects of Soltan. As I mentioned earlier, Danshen is Chinese sage or Salvia miltiorrhiza. The sage used in Western herbalism was Salvia officinalis. There are some 900 species of sage found around the world. Some 60 species of Angelica can be found in the Northern Hemisphere, and at least 2 of these species have been used in Western herbalism to treat women's issues. There is more to be said on this topic, so I'll make a separate video about the actions of different species of Angelica and sage. Thank you for watching this video, and I hope you'll join me for future videos in this series.